Okay. So levator labii superioris, aliqui nasi. What is the next muscle? Levator labii superioris. Okay. Next comes zygomaticus minor, zygomaticus major. Then comes levator anguli oris. Okay. These muscles are contracting together when we are smiling. Okay, see how the muscles are going upwards. So that is called as levator anguli oris. Okay, these muscles are contracting so that the lips and angle goes upwards. So there are 5 muscles in the upper lip which causes dilation of the oral cavity, opening of the mouth. Okay, these are all dilators. Dilators are 10. Okay, remember that. So total 5 muscles till now we have studied. Now what are the other muscles? Now we are going slowly to the angle. Okay. What are the muscles going to the angle? What are the muscles going to the angle? One we have already studied. That is levator anguli oris. Levator anguli oris. Okay. Next another muscle is horizontally backwards like this. Which muscle? You can see here. This muscle is called as risorius. What is it called as? Risorius. 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 Okay. What are the muscles? Levator anguli oris, risorius. Okay. Risorius. What is this risorius? This is an extended part of the platysma. Okay. In the neck, we have a big sheet of subcutaneous muscle which is called as platysma. Okay, that platysma comes till here, and from the angle it extends into the angle of the oral cavity. So that portion is called as risorius. Okay, clear all of you? And then comes the next part which is going down. That means which is causing angle down. Okay, what is this going down called as? Depression. Okay, so the muscle is called as depressor. Okay, depressor anguli oris. So we studied levator anguli oris. This muscle is depressor anguli oris. Okay, when we say we don't know, sad face. Okay, we draw a sad face. So anger is going down. That is called as depressor anguli oris. Okay, so what are the muscles? Upper lip, 4 muscles. What are the muscles? Levator labii superioris, aliqui nasi. Okay, levator labii superioris, zygomaticus minor, zygomaticus major. Okay, 4 muscles. Then at the angle, 3 muscles. What are the 3 muscles? Levator anguli oris, risorius, and depressor labii inferioris. Okay, depressor anguli oris. Okay, depressor anguli oris. Clear all of you? Everyone?
Yes, ma'am.
Yes, ma'am.
Okay. Then comes the lower lip. Okay, we studied upper lip, angle, lower lip. Now lower lip we are studying. What does lower lip? Only one thing which depresses the lower lip. Okay, this is the action. Okay, when we are depression of the lower lip, when we do that, what is happening? This lower lip is going down. So that is called as depressor, depression of labii, lip inferioris. Okay, lower lip. What is it called as? Depressor labii inferioris. Okay, depressor labii inferioris. So these are the muscles. And last one thing, one small muscle which is present at the chin. Okay, whenever we do like this, what is happening? You can see that this area is also constricting. Sides are also constricting. Okay, you can see that. So this area, this muscles are called as mentalis. Okay, this is the region where it is a mental region. So this here, the muscles which are present are called as mentalis. You can see 2 bellies here, mentalis. Okay, so 2 muscles for the lower lip. What are the 2 muscles for the lower lip? Depressor labii inferioris and mentalis. Okay, just a second. So here we are discussing about the muscles. So these are the 10 muscles around the oral cavity. We will see each muscle action, what exactly they are doing. Okay, just in a bit. But right now, just try to understand the name of the muscles. What are the muscles? First, levator labii superioris aliquinesi. Okay, levator labii superioris. Zygomaticus minor, zygomaticus major. Levator angulioris. It's not given here. Levator angulioris. Then comes the next muscle, rhizorius. Rhizorius is a part of platysma. Okay, when we do this, okay, our neck is also going up along with this muscle because this muscle is pulling. Okay, like this. So that is the action of rhizorius. Then you get depressor angulioris, the muscle which depresses the angle. Then comes to the lower lip, that is depressor labii inferioris and mentalis. Okay, so these are all the dilators. So we studied 9 dilators. Now one muscle is a constrictor. What is a constrictor here? The constrictor is the muscle which is around the oral cavity. Okay, all the muscles are actually reinforcing this muscle. Okay, and they join with these fibers and form a fibers which are around the oral cavity. This is called as orbicularis, same like orbit. Okay, this one orbicularis, this is also orbicularis oris. Oris is oral cavity. This is orbicularis oculi. This is orbicularis oris. Okay, orbicularis oris. So there are 10 muscles around the oral cavity. One is the constrictor, which is the orbicularis oris, and the rest are the dilators. Okay. Can anyone say the muscles around the oral cavity? Anyone? Try. Or should I pick?
Yes, ma'am.
Yes, you want to say?
I'll try, ma'am.
Okay, please try.
So there are 10 muscles around the oral cavity, starting from upper lip, levator labius superioris aliquinesi. It elevates the upper lip and nasolabial fold. Then there is levator labius superioris. It elevates the upper lip. Then third one is zygomaticus minor, and fourth one is zygomaticus major. Then around the angle of the oral cavity, there is a levator anguli oris. Then there is rhizorius, which is a portion of platysma. Then there is depressor anguli oris.
Right.
Then around the lower lip, there is depressor labia inferioris and mentalis. And around the oral cavity, there is orbicularis oris, which is a constrictor.
Yes, absolutely. Okay, so now we all should learn all these muscles by heart. Okay, with their names and actions. All these muscles you are supposed to learn. Okay, so we studied the muscles around the orbital cavity, the muscles around the nasal cavity, muscles around the oral cavity. Then we have one more orifice, that is ears. Okay, so around the ears we have 3 muscles. Okay, see here we can see around the ear. Don't worry about this temporalis. Temporalis is a deeper muscle covered by the temporal fascia. We will not see this muscle until we remove the temporal fascia. Now this temporal fascia is a thick fascia. Okay, but above that, just below the skin, we have certain muscles. Okay, some people can move the ears. Okay, someone can see without touching like this, they can still move the ears like this. Okay, how this is possible? Because these muscles are well developed in these people. In most of the people, what happens is these are already regressed. Okay, their function is almost regressed and stopped. That's why we cannot move our ears. Okay, but some people, the muscles are still developed well and they can move their ears. Okay, even if you see lower animals, you can see that they are moving their ears, right? So because of these muscles, what are the muscles? This muscle around the ear refers to auricularis. Okay, auricularis, auricularis. Cularis, auricularis. Okay, what are the muscles? Auricularis superior, auricularis posterior, and there is one more muscle in the anterior aspect, just beneath the skin. You remove the skin, you will see these muscles. Okay, but in fresh dissection, you can see, or fresh cadaver without embalming, then you can see all these muscles. But after embalming, these are very thin muscles. They are stuck to the skin and fascia, and you cannot separate them. Okay, so you cannot actually appreciate these muscles so well. The muscles of the scalp as well as face, you cannot appreciate well in during the dissection, because we have already embalmed long back. Okay, so that's why we cannot see these muscles well. So what are the muscles around the ear? Auricularis superior, auricularis anterior, and auricularis posterior. Okay, so here you can see the rhizorius. See, this is the platysma and this is the rhizorius. Okay, and rest of the muscles. Okay, levator anguli and depressor anguli. Depressor labia inferioris and mentalis is in the front. Okay, so what you are supposed to do today? What is the homework? All of you have to draw the diagram showing the muscles of facial expression and label them. Okay, make a list and study. Okay, so that you will have to submit in the Google Classroom. Please remind me, after completing this session, I will send the link for the previous homework. Okay, so you can submit in the link, and I'll have to see that all of you have to submit, right? All of you have to submit your homework. We will try to see how many people have submitted and who haven't. Okay, so these are the main important concepts which you have to remember. Okay, so all of you, the name of the muscles, I hope everyone are clear. The muscles around the forehead, muscles around the orbital area, muscles around the nasal area, muscles around the oral cavity, and muscles around the ear. Okay, auricular area, auricular orifice. So these are the things which are important for understanding. Till here everyone are clear?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Yes. So I'll
Yes,
give
ma'am.
this presentation to you, but unfortunately we have some videos here, and the videos in my presentation, when I try to change it or send it, it is in a different format, so you cannot access those videos. Just the pictures and the slides you can see, because I'll have to convert this into a PDF and send you. So you may not have to, you'll not able to see those videos. Okay. So already the muscles are labeled here. You can see all the muscles. Okay, levator angularis, everything is labeled and listed out. You can study later on. Pictures are here. So this is the platysma. You can see the platysma just beneath the skin and superficial fascia. Within the superficial fascia, you will see the platysma. And this is the how the rhizorius is entering into the face. Okay. See this one. Okay, it's a video showing orbicularis oculi. Now, why we have to study orbicularis oculi? It's a short note question. Okay, this muscle will be asked. Rest all muscles, you need not study origin insertion. Okay, but three muscles are important. What are the three muscles? One is orbicularis oculi. Okay, next is the buccinator. Yeah, I totally forgot that. One more muscle, there is a muscle inside which is blowing the mouth. Okay, air from the mouth, this action. So this muscle is also present. Yeah, 10 muscles around the oral cavity, and one is the constrictor. Okay, total 11. So this is the buccinator. Okay, what is it? Buccinator, buccinator, buccinator. So you will have three muscles as a short note questions. What are the short note questions? One is orbicularis oculi, buccinator, and orbicularis oris. So here these three questions you will have to study its origin, insertion, nerve supply, actions. Okay, you will have to write as a short note question. So let's see orbicularis oculi. So here this is orbicularis oculi. Now please note it down. It has got three parts. What are the three parts? The area which is present here, that is a palpebral part. Okay, palpebrae refers to the eyelids. Now the area which is outside, this is called as orbital part. Okay, see here, this is the orbital part. and this is the palpebral part. They have nicely shown the orbital and palpebral part. Till here, I hope it is clear. Once again, we'll see that palpebral part is just on the eyelids, okay? And orbital part is around the orbit. See here, you can see the muscle fibers around the orbit, okay? Now see here, what is its origin? Now we have to study, there are three parts of orbicularis oculi. What are the three parts? Once again, we will see orbital part, palpebral part, and the lacrimal part. Okay, this portion which they are showing, that is the lacrimal part. Okay, so what are the three parts? Once again, I'll repeat the three parts: orbital part, palpebral part, and the lacrimal part. Okay, which you can see here. This lacrimal part is going in between deeper areas and getting attached to the just the corner of the eyelids. Okay, we will see that. Okay, so all these three parts, everyone are clear? Orbicularis oculi, what are the three parts?
Orbital part, palpebral part, and lacrimal part.
Lacrimal part.
Yes. So orbital part, palpebral part, and the lacrimal part. So where they are taking origin from? Now first let us see orbital part. Okay, orbital part takes origin from a medially. That means what you do, you just palpate your medial angle of the eye. Okay, here with your finger, you can feel some kind of strong structure. Okay, small rounded structure you can see at the middle angle of the eye, not inside the eye, outside the eye. Okay, here. So this is called as medial palpebral raphe. Okay, what is it called as? Medial palpebral raphe. RAPHAE, raphe. Okay, once again, we'll see that what is that? Medial palpebral raphe. So the fibers take origin from the medial palpebral raphe. They will not insert anywhere. They will make a circular fibers. Okay, they orbit around the eye. Okay, orbit around the orbit. Okay, they make a nice circle around the orbit and come and get inserted into the same medial palpebral raphe. Okay, so that means where they are starting, just beneath this ligament, you can see that there is a medial palpebral raphe. So from there it takes origin around the orbit. It passes around the orbit like this in circular motion and get inserted to the medial palpebral raphe. Okay, so that is the, now let's see the action of the orbital part. Now see here, this is the action of the palpebral part, not action of the orbital part. Orbital part, when it constricts, what happened when we close eyes tightly like this? Okay, so that is the action of the orbital part. Now if you are gently closing the eyelid, that is the action of palpebral part. Okay, so see here, what is the action? Before going action, let us see origin and insertion of palpebral part. Palpebral part takes origin from medial palpebral raphe and gets inserted to the lateral palpebral ligament, okay, which is on the lateral side, which you cannot feel that because that is inside the bone. Okay, so inside the bone we have one more small ligament that is called as lateral palpebral raphe, okay, or ligament. So this palpebral portion of the muscle fibers take origin from here, get inserted over here. Okay, clear all of you? Are you understanding?
Yes,
Ma'am, can you
ma'am.
repeat the insertion of the
Lateral
palpebral part?
palpebral ligament, okay, which is on the inner aspect here inside the orbit. Inside the orbit here, if you feel inside the orbit, bony wall, right? We cannot feel inside the bony wall here, right? So inside the lateral bony wall, here we can feel there is a small elevation. Okay, it is called as Whitnell's tubercle. So this lateral palpebral ligament gets attached to it. Okay, so that is the area where the lateral fibers, the fibers coming from the palpebral on the upper eyelid, okay, or lower eyelid, the fibers just pass like this and get inserted into the lateral palpebral ligament. So clear? Did you understand?
Yes, ma'am.
Okay, so that is the origin and insertion of palpebral fibers. Till here clear? So what is the action of palpebral fibers? Gentle closure of the eyes. Okay, that means only our eyelids are acting here, not the rest of the muscle. So palpebral fissure, when it gently closes, there is gentle closure. Only palpebral part of orbicularis oculi is acting. Now if you are closing tightly like this, then what happens? The orbital part is acting. Okay, now see the action. This is the palpebral portion. Now this is the orbital portion. Okay, action. So when you constrict tightly, okay, when you try to do a tight closure, okay, so what happens when you do a tight closure? See here what is happening. There are folds formed on the lateral sides. Okay, so they say these folds are called as crow's feet, right? So mostly when in old people, you can see lot of lateral folds on both sides of the eyes. So these wrinkles or lateral folds, these are called as crow's feet. Okay, they appear like a feet of a crow. So that's why how that muscle how that wrinkles are appearing, that is because the skin over this region loses fat and the muscle becomes weakened. That's why you can see the wrinkles over this region. Okay, so when you close tightly, you will see that there are some kind of wrinkles on the lateral aspects of the eyes. Okay, so that is the action of orbital part of the orbicularis oculi. Till here everyone clear?
Yes.
Yes, ma'am.
Now lower eyelid, okay, so this is upper eyelid. When it contracts, closure, only we are talking about closure. Okay, rest of the, we'll go back to the muscles here. Okay, now see here, we have studied about orbital and palpebral part. What about this lacrimal part? Okay, what is the lacrimal part? Inside the orbit, okay, here on the medial side, below this medial palpebral raphe, there is a sac. Okay, what is that sac? The sac is called as lacrimal sac. Okay, what is that lacrimal sac? Lacrimal sac is filled with the lacrimal fluid. Okay, what is lacrimal fluid, guys? Tears. Okay, so the gland is here. From here the tears are coming, moistening the eyes, stored inside the lacrimal sac, and enters into that lacrimal sac, drains into the nose. That's why when you cry, you also sneeze. Okay, this is only when it happens overflowing of the tears. Usually, normally, the lacrimal fluid moistens the eye. You see a moisture inside the eye. There is a layer of moisture inside the eye. So that is the function of lacrimal gland, to keep moistened. The eye is moistened because of the lacrimal fluid. When it is overflowing, then the overflowing lacrimal fluid is called as tears. Okay, so now what about this portion? What is the portion we are discussing about? That is a lacrimal part of the orbicularis oculi. Lacrimal part of the orbicularis oculi is attached to the medial palpebral raphe, okay, over the lacrimal sac, and gets attached to the margin of the eyelids. Okay, margin of the eyelids, along the margin of the eyelids here. Only upper eyelid, not the lower one. So that is a lacrimal part of the orbicularis oculi. Till here everyone clear? What are the three parts? We had studied about three parts of orbicularis oculi, that is orbital part, lacrimal part, and the palpebral part. Okay, what are its actions we had studied. So this is about the orbicularis oculi. Then rest of the muscles. This video shows rest of the muscles. Okay, let us see all the muscles. That is what they are showing is a medial palpebral raphe. Okay, lacrimal part. That is the orbicularis, orbital portion, and this is the action of palpebral part, and this is the action of orbital part. Okay, now opening of the upper eyelid, there is a specialized muscle. It is not present outside on the face. There is a muscle inside the orbit. Okay, that causes opening of the eyelids. Only when we open eyes, we are not using both the eyelids. Remember that. Okay, whenever we open the eyes, we are not using both eyelids, we are using only upper eyelid. Okay, so that muscle which is inside the orbit, which is opening the eye, okay, so that muscle is called as levator. Okay, levator palpebrae superioris. Okay, palpebrae means eyelid, levator elevates, levator palpebrae superioris. Okay, clear everyone? This is one muscle which we did not add here because this doesn't come under muscles of facial expression. But when you are saying the muscles which are closing and opening the orbit, okay, or not orbit, the palpebral fissure, then you have to mention that levator palpebrae superioris also. Okay, that opens the upper eyelid. That is how the eye is opening. Okay, our lower eyelid does not move upwards or downwards. Okay, it is just opening like that, it is present just like that. Only upper eyelid opens. Okay, the eye. Till here everyone clear?
Yes, ma'am.
Ma'am, can you please repeat the origin and insertion of lacrimal orbicular
Okay,
lacrimal part?
part,
Yes, ma'am.
it takes origin from where? From the medial palpebral raphe itself. Okay, where does it gets inserted? Into the skin of the see, it crosses the lacrimal sac. Okay, over the lacrimal sac, attaches to the lacrimal sac, because when this muscle constricts, it is pushing the lacrimal sac inside for the draining of the lacrimal fluid into the nose, and it gets attached along the margin, along this margin of the upper eyelid. Okay, so that is about, and in fact it comes even till the end of the eyelid sometimes. Okay, and in some of the books they give it gets attached to the lateral palpebral ligament as well. Okay, you can write both, no problem. Okay, if you see latest work, you will see only that muscle is only attached to the some portions of the upper eyelid only. Okay, so clear, don't worry about that. So everyone clear till here?
Okay,
Everyone,
ma'am. Thank you.
all of you?
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
Now let us see rest of the muscles. See the muscles. This is the orbicularis oris. Okay, orbicularis oris muscle. Now these are the muscles. Levator labii superioris aliquinesi. We are going orbicularis oris. Orbicularis oris again is a important question. Okay, what I want you to do, write down a table showing origin, insertion, nerve supply and actions of these three muscles. What are the three muscles? Orbicularis oculi, buccinator and orbicularis oris. Okay, so there are three muscles. Please write down this table and send it to me, okay, in a Google Classroom. The link I will share it today. So what are the two homeworks I had given? One is to draw the muscles of the face, and next is draw a table showing origin, insertion, nerve supply, actions of three muscles: orbicularis, oris, oculi and buccinator. This is the orbicularis oris. Now orbicularis oris again has got three layers. Okay, superficial layer, intermediate layer, deep layer. Don't worry about that. Okay, even you need not explain each layer ka origins and insertions much in detail. You just need to know that these fibers are circular and gets attached to the modiolus. What is modiolus? Modiolus is when you feel with your tongue on the angle of the mouth. Okay, angle of the mouth inside, feel with your tongue. Okay, you can feel a small nodule. Okay, small nodule will be there inside angle of the mouth, so that is called as modiolus. That is where the fibers circle, okay, and come here, cross. Okay, upper fibers, lower fibers, they circle, they are present beneath the skin. Okay, superficial fibers are present just beneath the skin. Intermediate fibers are combination of all the dilators. Okay, all the dilators come, cross and form the intermediate fibers. That means what happens? Upper lip fibers, lower lip muscles, they are coming, crossing, and lower lip fibers are going to the upper lip, upper lip fibers are going to the lower lip. So like that, intermediate stratum of the orbicularis oris is formed by the dilator muscles which come cross at the modiolus and go to the opposite lips. Okay. Deep part is attached to the bone. Okay, so bone, which part of the bone? This is the maxilla, this is the mandible. Okay, maxilla and mandible. In maxilla we have teeth. Okay, you can see the teeth. So above the teeth we can see this is the canine. Okay, at the level of canine we can see an elevation. This is called as canine eminence. What is it called as? Can you all see that? There is an elevation here. This is called as canine eminence. These are the incisors, 4 incisors we have and 1 canine. So this is the, on each side, 2 incisors and 1 canine. So on each side we can see above the canine we can see there is an elevation. Even you can feel in ourselves also. Okay, above the canine teeth, if you just keep your finger and palpate, you can feel that there is an elevation. So this is called as canine eminence. Okay, what is it called as? Canine eminence, elevation. So from there the fibers are coming and crossing and going to the modiolus. Okay, so there are 3 levels of orbicularis oris: superficial, intermediate and deep. Okay, superficial fibers, upper fibers and lower fibers, they are meeting at the, they are just present below the skin and fascia. Okay, just below the skin. Remove the skin, you see these fibers. They are circular, gets attached at the modiolus. Okay. Then we have intermediate stratum. All the muscles which we had seen bit back. Okay. These muscles, they cross with each other and go to the upper lip and the lower lip at the modiolus. These fibers form the intermediate layer. Then the deep fibers, which are coming from bony origin, they are coming from the canine eminences. Here, canine eminences. They cross and go to the modiolus. Okay, even at the lower teeth also, below also. So this is the 3 layers of orbicularis oris. Am I clear, everyone?
Yes, ma'am.
Yes. So please join back. We will complete this slide and stop. Okay. Then comes the next portion. See here. What are we doing in the next picture? Dissection. These are the muscles, dilators. We remove them. They are very thin muscles. Then we are going deep to show the origins of orbicularis oris. Okay, we remove rest of the muscles. See here, canine eminence, incisive fossa. From there we take origin. It takes origin and goes. Next is the buccinator muscle. Okay, this is the muscle which is called as buccinator. It is present on the angle like this. We have studied, right? Rhizorius, okay, levator anguli oris and depressor anguli oris. 3 muscles we had studied. Now if I remove these 3 muscles, then I will see this buccinator muscle. Okay, this is the muscle which is bit thicker and we can easily observe it in the dissection hall. Okay, this also has got upper part, intermediate part, lower part. Okay, so don't worry, these parts are bit